We'll take you live now to Canberra, where Chief Medical Officer Professor Paul Kelly is providing a COVID-19 update.
7 of those are overseas acquired in hotel quarantine, but the other elements are the 18 new cases that have been confirmed today up to 8 p.m. last night. 9 of those are in the Avalon cluster and are in that area of the Northern Beaches, and the northern part of the Northern Beaches. Most of those were in isolation, and so those are not of a major concern at the moment. They're all reasonably well and are in that area which is essentially locked down. The 9 cases outside of the Northern Beaches, of course, are a concern, and particularly that cluster which has now been labelled the Croydon cluster in the inner west of Sydney. And that's all of those cases are close contacts of the case that was mentioned yesterday in New South Wales, and then a couple of cases in Wollongong, as well as one other in northern Sydney. The other states, not a lot going on, all of those overseas acquired cases. We have pleasingly still very few cases in hospital. So despite that increase in cases in New South Wales, we only have 19 people hospitalised across the nation in relation to COVID, and no one in ICU. This is a very different situation to many other countries, as we've said a lot. There are the intensive care units in California, for example, are completely full and very much overwhelmed by the COVID situation. In the UK, in the last 24 hours, 51,000 new cases, and many people who have unfortunately passed away, and many in hospital. So we still have a very much different situation here in Australia, but those extra cases, particularly those ones that are outside of the Northern Beaches area, which we've been following for the last week or so, are a concern. Just a couple of other matters that have come up. There's been some discussion around vaccines and where we're up to in terms of vaccination plans here in Australia. They are on target. We are going ahead with those, all of those preparatory phases, which includes the procurement of vaccines, making sure that those deliveries are coming when they need to be here, that our regulators are continuing to work through this period and are eagerly awaiting further information from both AstraZeneca and Pfizer in the coming days. There are no approvals yet, no full approvals yet anywhere in the world for any COVID vaccine. The emergency use authorisation or similar mechanisms that are happening in some parts of the world are exactly that. They're for an emergency use. They are very limited. And we are now a few weeks into that situation in the UK, the US and other places. And we'll be watching and are watching very closely what is happening in relation to, firstly, the plans of the rollout and how that's working, what we can learn from those things, but particularly any safety concerns that may emerge with this increased numbers of vaccines that are being given in other parts of the world. We'll do our full assessment. Our Therapeutic Goods Administration is onto that. They're in close contact with other regulatory mechanisms throughout the world, virtually on a daily basis. And they'll be fast, but they'll be thorough. And we need to keep that confidence, and people should have confidence in that regulatory approach here in Australia, particularly around safety, but also quality of these brand new vaccines. The third point I just wanted to make was in relation to pre-flight testing. That's been mentioned in recent days, and there's been some interest particularly in relation to the variant strains that are coming out of the UK and South Africa, whether we should be changing our mechanisms there. We're meeting the Australian Health Protection Principal Committee. The AHPPC is meeting under my chairmanship every day. We met again today. We discussed pre-flight testing yesterday in particular, and again today. There's no change from our medical advice in relation to what should happen there, but we are looking at those issues carefully going forward. I would say that that Qantas some time ago had already introduced their own testing regime in relation to pre-flight testing. And so Qantas are the ones that are mostly associated with our assisted flights assisted by the Commonwealth to bring Australians home, particularly from the UK and from India at this time. So Qantas is testing everyone before they get on the flight. Anyone that's positive is not allowed to fly. And so, for example, in the most recent flight that came into Howard Springs, there were 12 people who were either positive or an indeterminate result from pre-flight testing, and they were refused boarding. So that's actually happening with Qantas. We understand that Singapore Airlines is also doing that, and will be, Minister Hunt has requested that I write to the other airlines that are coming into Australia to make sure that we know what they are doing in relation to pre-flight testing.